This is What's New Radio Extra Time. Each month, we share a longer interview with one of our guests in the energy sector on topics highlighting our services and our 100-100 vision for Barbados. During the course of 2020, we learned many lessons from living with COVID-19 coronavirus, which we have incorporated into our planning for 2021. At the onset of the worldwide pandemic, Light and Power invited Dr. Rufus Ewing, Health Systems and Services Advisor with the Pan American Health Organization, PAHO for Barbados and the Eastern Caribbean, to speak to our employees about the coronavirus. So it's timely a year later to bring him back to share with us further updates about COVID-19 and its impact on health and safety in the workplace. He is speaking with Manager, Communications and Government Relations for Light and Power, Jackie Marshall-Clark.
Welcome to What's New Radio. We truly value your time with us.
Thank you, Jackie. It's my pleasure to be here again in your presence.
It's a new year. COVID-19 is very present around the world, and it appears as though it's gaining a foothold here in the Caribbean as the positive cases seem to be on the increase. We understand the government's COVID-19 directives, and we've been living with the safety protocols for the past 12 months. What does PAHO now know for sure about the virus?
Well, there's a lot that have been learned about the virus during the past year, and some of them are still the same. One, we know that once you get infected with the virus, you have about 2 to 14-day period before you develop any kind of symptoms, which is called the incubation period. Some people may not develop symptoms at all, and those are considered asymptomatic. But even if they don't develop symptoms, there is a time period between 5 to 7 days when persons will develop a significant amount of virus in the body so that they can become infectious. And so it is an infectious virus transmitted from person to person through droplet infections. The droplet may come from your nostrils to the other person's nostrils or land on surfaces in your vicinity or on your hands, and you have a direct contact with that person or that surface and transmit the virus once it goes through your eyes, nose, or mouth. And those are the only routes through which the virus can enter the body, by going through your eyes, nose, or mouth. We know that it does cause significant disease. There have been millions of people, close to 2 million persons who have died from the disease. But those persons who have comorbidities, other diseases such as heart problems, diabetes, hypertension, cancer, those persons are at highest risk of succumbing to the disease or developing severe disease if they contract the virus. So that is still pretty much well known. We know that now there is a new variant of the virus that is circulating, found in the UK, South Africa, Australia, different places, and possibly, and even in the US right now, and possibly here in the Caribbean. And that new variant of the virus, even though it does not cause more severe disease when you catch the virus, it is more infectious, meaning that it is more easily transmitted from person to person than the previous version of the virus. But it is still a virus that causes significant concern, causing disruption of livelihood within our various countries and also loss of life within our various countries. So it is a significant public health concern that we must continue to fight and address.
So Light and Power has had a strong record of being proactive and planning for emergencies. Our communication and our assistance to our customers, to the government, to energy stakeholders have always been timely and exemplary. But it's fair to say that the fast-moving and unknown variables of COVID-19 have impacted all areas of our business emergency planning and have presented all businesses, not just Light and Power, with unforeseen challenges. So really, what is the best way to stop the spread of this virus in the workplace?
Well, the best way to stop the spread of the virus, be it in the workplace, in the community, in the home, in public institutions, it's really the same. We know that the virus is transmitted through droplet infections coming from the nose. And as I said, through direct contact with persons taking their hands, putting it in their eyes, their nose, or their mouth, because that is the only route through which it could enter the body. Mm-hmm. So obviously, the practicing hand hygiene, frequent washing of hands with soap and water, or using hand sanitizers reduces the virus load on your hands, if it is present, and reduces the transmission to other persons. So that's why frequent hand washing, using hand sanitizers, reduces transmission in the workplace or anywhere else in the home, community, etc. Likewise, proper cough etiquettes. Cover your cough, Now, the in thing is that people are complying, wear your mask. Because mask has been shown to reduce the transmission of virus from your nostrils or your mouth in the atmosphere and infecting others. So you protect others and yourself when you wear the mask and the others wear the mask, all right? So those simple measures that persons can do, simple things, to try to protect themselves and others around them in the workplace and to reduce the spread of the virus in the community. Now, there are other public health measures that organizations and individuals can do and safeguards that you can put in place, such as sanitizing your various aspects of your environment. If you know there's a surface that is frequently used, I'll give you an example. Within our office setting here, we have a system where we walk, how we walk. We have a one-way street. We have a long corridors down, we have one-way street. So no two person come in close contact with each other in walking in different directions. We also have someone who comes routinely, probably every half hour, every hour, and cleans the doorknobs. Wipe it down, sanitize it, because persons would come in and out of your office. So it really reduces the opportunities for a virus that lands on surface to be picked up by others who may come in contact with those surface. And there are other measures that workplace could also put in place, like temperature screening, within the workplace, proper communication with your staff to report that if they have a fever or cough, to please stay home and not come into the workplace. Nowadays, people are asking employees to, if you don't really need to do the work that you need to do in the office, stay home and do it. Telework. So you have a telework policy because there are many benefits from working from home. One, you reduce the consumption of electricity. You may not want to do that in your organization. Reduce the consumption of electricity within your organization, all right? And reduce the physical presence of persons and congestion of persons within the organization, and reduces the risk of transmission. So those are policies that organizations could put in place. If you are a workplace where you come in contact with the public frequently, then you may want to put in measures to also protect the public by putting in those same screening measures, such as temperature screening, etc., and also sanitizing your hand sanitizing station at the entrance to the workplace and wearing of masks within the workplace. So those are measures that you can do as an organization to protect your employees and also your customers coming to your organization.
You have touched on quite a few of the things that we are doing at Light and Power, where we thought about how do we protect our customers, something very important to us. We certainly have put in place all the temperature screening, the sanitizers at the door and all that. But the big thing for us was reducing the number of people coming into the payment hall and only allowing persons in, I think we're doing 65 years and older. Everybody else go online. And then those persons who must come to the office to us to see us would come by appointment.
So in addition to those measures in terms of putting in hand sanitizing stations, customers wearing masks within the workspace or service hall, and the temperature checks, you could probably also have a logbook for persons who are coming into establishment to write their names and contact numbers, because it really helps in the event that someone, that person probably would have been infected, or someone in your organization would have been infected and come in contact with that customer. You can help the country do contact tracing by having that information available to share with the government. Also, the importance of them maintaining certain physical distance and what we call social distancing within the lines and customer service lines. So when people come to line up, you don't want them to crowd your space. You may want to limit the number of persons in the space in the first place into the building, depending on the size. And so it's very important for those simple measures: hand hygiene, wearing of masks, temperature checks, logging of information of persons to enter, and physical distancing within the organization.
And businesses like ours use a lot of machinery and shared equipment. For example, our vehicles. How should we reduce the risk there?
Yeah, well, as I said earlier, it is important to sanitize those surfaces that are touched frequently, particularly if they're shared by, say, drivers who may share a vehicle. Even though they may be using masks within the vehicle, when they leave the vehicle, they may have in their own private setting, use their hands or cough into their hands, put on the steering wheel. Someone else come immediately after them, jump into the vehicle and touch the steering wheel. So those things are important to sanitize. So you can also have a policy where you can have hand sanitizing station or wipes within the vehicles that's accessible, that they can use to clean down those surfaces themselves before it is used. And that should be practice, a policy that you should put in place to help with that. There are also other measures where persons, in terms of utilizing vehicles, some of them may You have vehicles specific to certain groups of individuals without mixing them, right? So you don't share it. If it's not necessary, you don't share them. And it's personal to hold the equipment.
And we have done some of that, and we have ensured that our drivers, they use one vehicle. Vehicles are assigned to certain persons, and then we reduce the number of persons in the cab at any time. So there are now 2 persons per shift and not 3 as we would have done before. Again, in every way, trying to protect the health and the wellness of our employees as we do with the others. What about employees at home, Dr. Ewing? Is there anything that we should tell them to ensure their safety and well-being while working from home?
Yes, I mean, I guess while working from home, they should really maintain all of those practices that we consider appropriate to reduce transmission within the home setting and to prevent themselves from also getting infected with COVID-19. But, within the workplace, the most important thing about the workplace infections is that those persons who at home, who may feel as if they have the opportunity now to go out into the public and do as they like. And it's important to know that you can only control infection within your workspace. Those persons at home must be educated enough to know that if you're going out in public, to avoid what we call the 3 C's, all right? Close contact, crowded places, and confined spaces, all right? The 3 C's, you avoid them. And in situations where you find yourself in those confined spaces, you should ensure that you wear a mask because sometimes you can't avoid it. For example, you go in an elevator. Most times when I see somebody going to the elevator, I say, no, you go first, I'll wait till it come again, right? You don't go into the elevator unnecessarily with 6 and 7 persons. So avoid those confined spaces. But if you're already there and people jam it, make sure you're wearing your mask, right? You never know what happened. So those are things that you need to educate your staff about. Avoid public settings and situations where you can contract the virus, like bus crawls and other things like that, so that you wouldn't bring the infection in your home and then later on you bring it in your workplace. Mm-hmm. Because it impacts not only your family settings and the lives of those persons in your home who may be susceptible or vulnerable, but it also impacts your livelihood by putting your organization in jeopardy of having to close and having service to do deep cleaning, etc., because of the outbreak.
So I have 2 questions to ask you coming out of all that you've just shared with me there. Let me ask this one first. And I really want to know, because I am one of those employees now working remotely. What advice, what would you tell us? How do we maintain our own mental health in this environment? We've now been working from home for a prolonged time. So a little out of what you were discussing about protecting ourselves health-wise, let's go to mental health. What can I do to help look after my own mental health as I work from home and have been for a prolonged period of time?
Well, working from home does not mean, one, that you're in quarantine, right? I mean, I just came out of a mandatory quarantine because of travel, and I've been in there for about 10 days. Fortunately for me, I was able to go outside and walk around. And so you're not confined to your house space. You're still able to go outside, walk around. There's no curfew for going to the beach. Go to the beach, avoid crowds, enjoy life. Go walk around the garrison, exercise, keep fitness. Those are the things that keep you healthy. Those are the things that keep you sane. So even though you're not at work, the only thing you're missing at work is you don't have the opportunity to collaborate and interact socially with your colleagues, right? But other than that, everything else, you can keep your sanity by doing those things that keep your mind and body healthy. Walks, exercise, outside activities that are not crowd related, and practice social distancing and enjoying some activities that you really, really, really enjoy. And that's how you can keep your sanity. If you're really having problems coping, then, speak to a family member, call a friend. If not, have a little mental health talk with one of your local psychologists and let them support you through the process. And that's what we need to do.
Thank you for that. And this is a question that many people ask. If an employee contracts COVID and then recovers and then returns to work, are those persons now immune to COVID-19?
No. I mean, to what degree persons is conferred immunity after being infected is still on one of the unknowns, meaning that you don't know if they can catch it again, how long that temporary immunity will last. Mm-hmm. Because we've only been going with this for a year now. And so there have been anecdotal studies to suggest that there's reinfection, but it's not overwhelming to suggest that, yes, you can get reinfected afterwards. So I would advise those same individuals to maintain all of the habits that they were practicing prior to getting infected. Not because you're infected mean that you have to not wear a mask, not wash your hands, not obey the various rules to prevent transmission. Because, you yourself may be able to catch it again or in past transmit it to others. So yes, they should maintain all of those practices again as if they are still vulnerable and susceptible.
Mm-hmm. Well, a good segue into vaccines and being vaccinated. I want to talk about that. We've been hearing quite a lot, about the different vaccines available. If it's the same virus, why and how are these vaccines different?
How the body responds, your natural immunity is when the virus enters your body, it then produces what we call antibodies against the virus to allow the virus itself to be destroyed by the body's natural white blood cells and other mechanisms that they have, defense mechanisms that they have. So the antibodies tag the virus and say, I tag you, I'll mark you, my other cells are going to come and kill you off. And that happens because there are certain proteins on the virus that now become known to the body, and they produce antibodies against it. Those antibodies sometimes last for a long while, and if the person becomes infected again, then the response will be quicker this time. They already have some ammunition that they have stored up from the last time and ready to kill it off from the moment it enters the body. Now, vaccines are kind of similar in a way in that what you do, the most commonly talked about one that we have is not a traditional type of vaccine. This is called a messenger RNA vaccine. So what they did is they know the genetic sequence of the virus, and they take what they call the mRNA and map it to recreate that protein that the normal body cells normally cling to. And they will reproduce those proteins, not the virus, the proteins of the virus in the body. And the same thing happens, it produces antibodies against those proteins. In this case, it is called the spike proteins. You may see the coronavirus with all these little prongs, right? The spike proteins is what is then produced. They produce antibodies against it so that if you happen to come in contact with COVID again, you will have an immediate immune response where the bodies have a pre-stored antibodies, preformed antibodies to go against the virus. Now, the other method is the old methods where, like what we had with certain things like measles and rubella and stuff like that, where they actually take or polio, the live or attenuated or killed virus, and put it into the body, and then it developed antibodies against the virus. And those antibodies now are then prepared, remembered, so that if you come in contact with the virus again, it produces those same antibodies in a quicker response time to kill off the virus. So those are the two methods that are being used now. But the biology and the immunology is the same, meaning that all you want to do is to enable the body to produce antibodies and have an early immune response to the virus in the event it enters the body. But there are different methods of triggering that response. That's as simple as I can put it for you right now.
Well, it was good information. Thank you, because everybody is asking about vaccines and being vaccinated at this time. So here's a question for you as a representative of PAHO. Should the pandemic get worse and we're unable to vaccinate quick enough, does PAHO have a crisis plan for the region?
From the time the pandemic started, and even before, there's a forum called the Gavi, the Global Alliance for Vaccines and Immunization. And what they do is to support the development of vaccines for situations like this, and then have a method for distribution of the vaccines in a kind of an equitable manner to countries in remote and vulnerable populations and groups. For this pandemic, that Gavi vaccine is being distributed through what we call the COVAX facility, which is a coronavirus vaccine alliance group that support countries. And so a lot of the countries in the Caribbean region have already engaged and have relationships and contracts to get vaccines from the COVAX facility. All of the countries in the Caribbean. Some of them at different, depending on your economic status and level, you may get them free of cost. And some of them you may have to pay for them. And then the ratio of, I think they're starting off with having 20% of the population is a target to be immunized in the first go round. So yes, those plans are well in advance, and Barbados itself is currently working on acquiring and hopefully acquire the vaccines within a few months. And so those plans are well advanced in development.
I have one final question for you, and because I know that on our radio program, several persons listen, other businesses listen as well and listen for the takeaways. So I'm asking you, during this period, this pandemic period, what do you see as some of the opportunities in the areas of health and wellness and safety for other companies?
I think that what this pandemic has brought to light is that companies now should even more so appreciate and value their employees, their asset. I mean, you invested in them because your company's wealth and productivity is dependent upon the health and safety of your employees. And so it is important that you, through all of your policy and development and strategies that you have, you should pay particular attention to health and safety in the workplace. And that includes ensuring the health and safety of your employees and their well-being, developing workplace programs, supporting persons living healthy, exercise, eating healthy, etc., through many different ways, maybe gym memberships, maybe through ensuring that they have annual health checkups, to having insurance coverage, and creating workspaces where they may have actually gym within the workplace that they can go to. So these are things, and then putting your safety protocols, because this is not just for COVID and this pandemic, because others will come.
Health and wellness has always been very important for us at Light and Power, but in the last year, we've had opportunities to meet with our EMERA team. So health and wellness is now a part of a wider policy-making group and decision-making for how do we keep our employees safe, how do we keep them healthy, how do we maintain health and well-being, and even for our customers. So we're not just talking about it as a company at Light and Power, but we're now doing this as a group-wide policy and discussion with all our EMERA affiliates.
No, and I'm sure that will reap dividends for your company and your employees. As I said, the employees having more time out of the office space is good for them. Persons having to be able to telework is even better for the organization, better for them. As long as the organization can show that the productivity remains the same and that individual remains the same, teleworking as opposed to being in the physical space is always better for them to be away from the physical space and show up from time to time so that everybody in the organization will know you. But the way we are communicating now and having meetings, this is the new way that we will be doing things in the future. And it'll make it more efficient in having meetings. You don't have to dash across town at 50 miles an hour to catch a meeting when you can pull up your laptop and join the meeting virtually. So those are things that, this pandemic has really shown us how to be more creative and innovative in the way we think and in the way we do business. And I think it will reap dividends in the end.
For teleworking, Dr. Ewing, we've been testing that at Light and Power some 2 years even before the pandemic came. And so when we had to move into getting everybody away from the office and working from home and working remotely, it was not as difficult a task. The transition was not that hard for the company because we had tested it before. In the area of customers, we had started planning, moving a lot of people online and e-billing and all that. But of course, it made us move to that position more rapidly. And today I can say that we have so many customers now happily doing their business with us online. They're not telephoning us anymore. They're actually going to the portal and sending their service queries online, chatting online, and so on. So I think digitally, we have certainly stepped up the game and we are ready to move on this platform and move forward from here.
Yeah, and that is great. And you'll find that same kind of thing in the health arena as well, because as you know, before persons were not comfortable speaking to the doctor in this forum through telemedicine and telehealth. But now persons were forced to do that during this pandemic for many different reasons. And so now the digital health initiative has taken off. And it's important because not only you can really consult your physicians or your healthcare team through a video consult, but also it improves health literacy of your employees because they now have better access digitally to health information that they would have otherwise have access. So that's another way in which you as an organization can partner with various health groups to ensure that this digital health information and health literacy information is available, which you call knowledge management is available within your organization to keep them healthy, educate them, because the more educated you are, then the better you will take care of yourself. The more health literate you are, the better you will take care of your health, the benefit of yourself and your organization.
If anybody had asked us about doing our radio program via Zoom 2 years ago? We would say certainly not. But over the past year, we've been doing it here. We haven't been to the studio since March. And as much as I miss seeing my producers and being able to interact with them, we've been doing just fine doing What's New Radio via Zoom. And I know that the customers still receive all the information and they appreciate the radio program very much. I could stay here much longer, Dr. Ewing, and ask you so many more questions, but we've got to go. When we met last year, you left me with something and it helped me through the pandemic period when you said to me, always remember men. You remember that? That we can, the virus,
avoid men. Mm-hmm.
Avoid men, the mouth, the eyes, and the nose. That's it. I know today you left me with something else. You said the 3 C's. Remind me what the 3 C's are again.
Right. So close contact, confined spaces, and crowded places. Close contact, avoid them. If you have to do it with close contact, like an intimate dinner with someone who you don't know well, from a different bubble, social bubble, avoid confined space. Don't jump into an elevator with 10 persons in it. Don't care how short the ride is. But if you find yourself in one that you couldn't get out of, put your mask on, wear your mask. And avoid crowded places, right? Where there are lots of people and people milling everywhere and you cannot keep that physical distance that you would like to have. And in that situation again, wear a mask.
Wow, thank you so very much. You've given me a lot of information to help us as we all continue to manage the environment that we're in. I wish you well, as always, and I want to continue to encourage you to be safe.
What's New Radio is broadcast on radio every month, or you can listen to past episodes on our website, blpc.com.bb. Find us on social media at BLPC Online or tweet BLPC. Our customer service team is always ready to serve you. Call 626-4300 during office hours or 626-9000 for emergency assistance.